Recognizing the member for New Westminster.
Thank you, Honourable Speaker. Every member of this House has been touched by cancer, and we all understand the critical role of research and cancer care to treat this disease and to save lives. So it was deeply concerning to learn that oncologists at the BC Cancer Agency and the BC Association of Radiation Oncologists have written to this government about unacceptable wait times and staff shortages, stating, quote, "It is not possible to continue to provide quality care and research under the existing conditions." When the former CEO of the Cancer Agency raised some alarm bells a few weeks ago, the Minister of Health was quick to dismiss his concerns. Will he now acknowledge that the situation has deteriorated so much on his watch that oncologists are now saying that treatment and care is compromised?
Minister of Health.
Thank you very much, Honourable Speaker, and I know all members of the House understand the world-leading organization that BC Cancer Agency is, and the cutting-edge work that's been done there. We all heard from the Terry Fox Research Institute, we heard from Lung Cancer Canada this week about the great work that's ongoing here in British Columbia, where we've got personalized oncogenomic medicine tailoring treatment to someone's individual form of a cancer to reduce side effects, increase efficacy of the treatment. Madam Speaker, that world-leading treatment, that world-leading research is happening here in British Columbia. We are committed to ensuring that that world-leading organization continues to be strong for the population of British Columbia.
Member for New Westminster on a supplemental.
Thank you, Honourable Speaker. And yes, we were all present at some very moving events in the last few days to hear from cancer patients and from some of these leading oncologists. And no one is questioning the superb work that takes place at the BC Cancer Agency. But surely something is not working, Honourable Speaker, when the number of people waiting over 4 weeks for treatment has more than doubled in the last 7 years. The individuals who wrote this letter represent every doctor who treats cancer patients in the province of British Columbia. Many of us have trusted them with our lives and with the lives of our loved ones. Surely the minister should trust them enough to stop claiming that everything is just okay. Will the minister commit personally that he will sit down and listen to these cancer specialists so that they can get on with doing the work that they want to be doing and we need them to be doing to treat cancer and cure cancer for the thousands of British Columbians who suffer from this disease?
Minister of Health.
Thank you very much, Honourable Speaker. And I know all members do understand the great work that's going on at BC Cancer Agency, and I certainly don't want to give the impression that we're not involved in making sure that they can continue to do that great work. As part of our work around the health system, we did a strategic priorities document. That was one of the first things I did as minister, was review the situation, look at the population of British Columbia, the changing demographics and the needs of British Columbians. Certainly as the population ages, we know, Madam Speaker, that the incidence of cancer will grow as it does with age. And so we have already started looking at this with the BC Cancer Agency and the Provincial Health Services Authority. The letter that the honourable member mentions is members of a physician workload committee. That's because we are looking at the resources of the BC Cancer Agency. We're looking at what the needs are around the province. Work will continue because I, along with members opposite, want to make sure that this organization remains a world-leading organization here in BC.